Hello, today I want to talk to you about the biological surgical concept of MEDIDENT Bavaria, which is a crucial part of our therapy in our clinic. So, the biological surgical concept of MEDIDENT Bavaria, what is it? It's a precisely tuned and optimized system all around your surgical treatment here in our dental clinic for biological dentistry. And the clue is it works with nature and not against it. So what we try to do is we want to use the power of nature, the power of your body, the power of your regeneration as much as we can and work with it and not against it. So in each single step is very important and serves to reach the ultimate goal, which is optimal healing. Well, the surgical concept of MEDIDENT Bavaria is, well, the first part is before the operation, so before the surgery. So please take care that your vitamin D3 level is at least at the time of the surgery at 70 nanogram per milliliter in order to allow your body a perfect healing. So vitamin D is very, very important when it comes to bone healing and in general tissue healing. So this can be adjusted by your own physician or alternative practitioner, or according to our bone healing protocol, which you can order on the internet, MEDIDENT Bavaria Vital. So this is you can see it on the picture here. It's a combination of vitamins and highly effective minerals, which contribute to raise your vitamin and mineral level in your body prior to the operation. So then please check and report the blood value for your vitamin D3 level 14 days before your surgery appointment here in our clinic. Because if you report it to us and it's perfect, then it's all perfect. But if it's a little bit too low, we can give you some advice how to raise your vitamin D level in the next weeks so that when you come here, your vitamin D level is at least at the 70 nanograms. So it can also be higher, no problem. It can be up to 150, no worries about that. So, but 70 is the lowest border. So what we use in addition to our concept is healing frequencies. So as you maybe know, your body consists of a lot of billions of cells, and the cells are also like a space which is also can be influenced by frequencies. And so we use healing frequencies in the background, and your body and your immune system, your nervous system, everything goes into the relaxation mode and takes away fear and stress and anger and such things, so you can just fully relax. We also help with our naturopath in our clinic with acupuncture for relaxation, and this helps to relax the muscles and also helps you to open the mouth a little bit longer. So what we also use is the matrix rhythm therapy. You can see this device on the lower right side. So this device is a kind of physiotherapy tool, and it helps to relax the muscles in an optimal way. And it also optimizes the oxygenation in tissues, and it provides for better blood circulation and better healing and less pain. So this is a very, very nice tool which we use prior and after the surgery, just to do everything that the healing is going to be perfect. So what you also use is infusions with vitamins. So we use vitamin IVs. Why? Because they support the body immediately during the surgery. And what is in the IV? It contains magnesium and procaine, and these two things, for example, help to relax the muscles. It helps to open the mouth and calms the body and the mind. And we have really the vitamins on board directly during the surgery via the IV of vitamins. So then we use another pair of infusion, like an IV against infection, and which reduces the swelling. So what we use is clindamycin. It's an antibiotic, and dexamethasone we use against swelling. So often, of course, the question, why do we use antibiotics? So it's recommended by naturopath and specialists in medicine, and we use it only as a single shot. Okay, so we use it through the veins, like through the veins when we make the IV, and it's a single shot, and it helps the body to fight against the bacteria, but it does not destroy or damage the intestine. So that's the most important thing, because regular dentists would use tablets or would use pills to swallow for 2 or 3 weeks, and this is, of course, as we all know, very bad for the intestine. But with the single shot of the clindamycin antibiotic, we have great results, and it's another security measurement for a perfect healing. Also, we use neural therapy. So what is this? We make a local injection of traumal procaine and also dexamethasone in the surgery areas. And what does it make? It attracts healing cells, and it improves wound healing and reduces also the swelling. So it's also very helpful tool when it comes to provide for a perfect healing. So what is also important when we perform the surgery, that we do this in a really gentle and minimally invasive surgical procedure. So we use really tiny cuts, everything is tiny, and we also use the ultrasonic technology, which is called piezo surgery. And this is a tool, you maybe know it. It's very soft and it's very effective, but it destroys or cleans the wound. It cleans the wound by destroying the bacteria, but the original tissue, like the original bone, will not be touched and not be destroyed. So we preserve the healthy parts and we clean the sick parts. And it's a high technology working on ultrasonic basis. It's perfect for minimally invasive and gentle surgical procedures. Also, we use ozone therapy. What makes ozone? Ozone is for biological disinfection of the wound area. So it works against bacteria, fungi, and viruses. And it's a so-called biological antibiotic. And ozone is a special combination of yes, it's O3 in the chemical device, and it's really very good for disinfection and also for attracting healing cells. And this is perfect. We love to use ozone during our surgeries because it helps the body to heal and makes everything perfectly clean. So the suture we do, of course, we close the wounds with perfect sutures, which are also from biomaterials, and they are self-dissolving, so they disappear by themselves, and yeah, self-dissolving threads. So the materials we use, so if we use foreign materials, like for example implants are a foreign material, but when we use foreign materials, we use it only the highly biocompatible ones, because like ceramic. Okay, so as you know, ceramic is no stressor for the body. The body accepts it like it would be an own material, like it would be an own bone, for example. And so we use ceramic as a foreign material, or what is better, the body's own material. So we come to that later. we use, for example, the PRF technique. I explain it to you later. What is important, we do not use any animal materials, for example, from porks or from beef, which is very popular in regular dentistry or conventional dentistry. But we don't use that because you can imagine that material from the pork or from the beef is very, very foreign to your body, and your body reacts to this. And so this is why we use either ceramic, like the highest biocompatible material in the world, or the body's own material. Well, and then let's go to the PRF. So what we do is the blood collection and preparation of PRF. So it's obtained from one's own blood, and it's centrifuged, and by the centrifugation we get healing and stem cells from your own blood. So by using PRF, we have autologous blood and stem cells, and we draw the blood directly before the procedure and then make the centrifugation, as I mentioned. And the advantage is it's 100% the body's own material, so no foreign material is needed here. And we have many healing promoting cells in this PRF, and it's very accelerating to the wound healing. So you can see here the glass after the centrifugation, and here you see the PRF membranes. It's only from your own blood after centrifugation. And when do we use it? We use it every time when we perform surgery or we have any operations. And we put it, for example, around the implants. We put it in the cleaned cavitations. We put it into the wound and the jawbone after extraction, just to fill up the spaces on the one hand, but on the other hand, also to use the healing promoting cells, the stem cells in the area where we did the surgery, to promote the perfect and the best healing which we can have. So after the surgery, we have a special cooling lounge, we call it. So it's a special room where you have your where you can rest and you have peace there. And then we provide for you the helotherm mask. You see it here on the right side of the woman's head. And this is a special device which cools your face and also the tissue with the ideal temperature, about 17 degrees. And this improves the metabolism in the surgical area. So that means it increases the oxygen supply on the one hand and reduces pain and swelling on the other hand. So this device is really perfect for avoiding swelling and just boosting also the healing. So what is a kind of present from us is you got the post-surgery care kit by MEDIDENT Bavaria. So this is a kind of surprise, but I can give you a short view in it. There are, for example, homeopathic remedies for good cure. So like we have arnica or something like that. Perfect mixture of homeopathic substances which also support your body in healing. And again, we use in our room where the healing launches, the cooling launches, we use also healing frequencies which help your body to recover. Well, what about rest? I would suggest for you to rest at least 3 days after surgery. Better would be 1 week. It's just to give your body the chance to recover and to get into the parasympathetic mode where regeneration is possible. So please do not make any sports for 1 to 2 weeks, and air traveling after 2 weeks at the earliest. So if needed for your job, we can give you a sick note, for example, for about 1 or 2 weeks, no problem with that. And please keep up your vitamin and nutrient balance very high. So for approximately 6 weeks after the surgery, please take your the supplements with vitamins and minerals. Keep on using them and swallowing them for 6 weeks to keep up a high level of vitamin and minerals, because your body needs this right now, okay, for 6 weeks after the surgery. And then you can reduce it maybe to the half. And of course, for lifetime, you should also again use supplements through actually all of your lifetime. So many people think or ask me, can I also oversleep the procedure? Can I sleep or do something with that? And the answer is yes, you can. We can make a sedation with you. So it's a short infusion with midazolam. It's called dormicum. Maybe you heard already about it. And has an anxiolytic and relaxing effect. And you're still conscious. You breathe by your own, but you're kind of relaxed and sleepy, and most people start to sleep during the surgery. Or if you are very much afraid about the procedure, we can also make narcosis, because we have an anesthesiologist in our practice, and you can really do all treatments also in narcosis if necessary. So what to do if there are several interference fields? So this is also a often question. So we have two possibilities. One is we can do the all-in-one concept. So it means to clear all interference fields in one session. So the advantage is that we have an immediate relief of the immune system. And it's a kind of a reset effect for your autonomous nervous system and for your immune system. So by performing the all-at-once or the all-in-one surgery, just to remove all interference fields in one session, the advantage is that you have the reset effect, and your immune system really says thank you to you, because everything is cleaned out at one session. So if this would be too much for you, maybe for several reasons, we can do also step-by-step procedures. No worries about that. We can make different steps on different times. So some people say, okay, let's do this part in the lower jaw in this year and the upper jaw in the next year. There is nothing bad about that. What you don't have then is the reset effect, but you make your steps anyways, okay? So what is most important is to walk the path and empty your backpack. So if you empty your backpack in one step, is a good thing. It's actually the best thing. But if you say, okay, I empty my backpack step by step and take out 1 stone, for example, every year or every half a year, it's also perfect, because you do something for your health and for your regeneration. So it's up to you, and we can discuss it and what is better for you. So we can do it either all in one or step by step. So if you have more questions or need more information, you can look on our website. You can read my book, of course. It's only in Germany available in these times. It's called Die geheime Kraft der Zähne, which means the secret power of the teeth. Please watch YouTube. We have many English videos there, a German podcast, and follow us, of course, on Instagram and Facebook if you want. And you can also learn on a free expert webinar, which is also in German. So I hope this information was helpful for you. And if you have any questions, don't hesitate and contact us. And so far, I wish you all the best, and hope to see you soon and help you on your way to your health. Yours, Dr. Alexander Neubauer.